Have you ever wondered why testing is such an important part of fighting the coronavirus pandemic? Should everyone be tested? Wouldn't more testing just mean bigger case numbers and more restrictions? Hi, I'm Epi, and I'm here to answer that. Let's start with a simulation. Here's a grid of a small town with 1,000 people. Every colored square is a person. Blue squares are healthy people, and green squares are those with an infection. There are just a few of them at the beginning. As people move around and spend too much time near an infected person, they can become infected too. By the end of about 2 weeks, most people recover from the infection and turn yellow. A few succumb to the illness and disappear from the grid. I want to take a second to say that these numbers aren't real. We're just simulating how infections spread through a group of people so we can talk about testing. Okay, back to the grid. It's hard to count how many people are infected when they're all moving, so let's add a chart to keep track. The green line is the number of infected people. This kind of information is important during a pandemic. We can see when cases are rising so we can protect people and make public health decisions. Unfortunately, we don't have this information in real life because we don't know about every person's current health. Instead, we must test. Let's say that every day we're checking 10% of people for the virus. The solid green line is still the number of people infected, but now we have a dotted line that represents how many people have tested positive for the virus. That's going to be what we think is happening based on those tests. This gives us a pretty good idea of what is happening, right? Let's run the simulation again, but with 2 changes. I'm going to hide the number of infections, and we're going to test only 2.5% of people every day. You see, it starts out slow, but there are some serious spikes. A jump in cases like that could mean stay-at-home orders or other efforts to protect the public. What caused these spikes? Well, if I show you the number of infected cases, we can see that these spikes do not represent a real increase in cases. This is crazy. How can we see such a big spike when real cases are going down? The answer lies in the number of tests we're doing. When we don't test enough, like this time, there can be big spikes and dips, even showing the wrong direction from the truth. If we played it a few more times, we could see our dotted line saying that everything is okay, even when cases are actually climbing. One day, we might miss every sick person, and the next, we might catch tons and think there's a spike. These situations are more likely the less tests we do. So as we do more tests, we don't get more cases. What we do get is a clearer picture of what's really happening. With more tests comes more confidence for the public officials, and more help where it's needed the most. That's why there's such a push for increasing testing. In our simulation, we had a pretty good idea of what's going on with 10% testing, and made some bad decisions with 2.5% testing. These numbers can't be compared to the real world, since we only have 1,000 people in our game, but the United States is currently testing less than 0.1% of the population every day. 10% isn't the magic number, but more tests can never be a bad thing, whether you're worried about the virus or worried about your favorite restaurant closing again. This is a lot of information to take in, and to be honest, this is far from the whole picture. How does this change if it takes a week to get a test result? What happens when everyone wears a mask, social distances, or follows other protective orders? What about tests being mostly for sick people, also known as biased sampling? Well, I'll have to save those questions for future videos. If you'd like to try the simulations for yourself, it'll soon be available. Look for that in a future video. Thanks for watching, and let me know in the comments if you have more questions. Bye! This video was funded by the National Science Foundation and the University of Pittsburgh.